Perhaps you could tell us about what you could do regarding the back problems, as it's such a big problem around the world, and what you did for yourself after you've described the different pelvis positions.
Yes, because I've been told I should take no active part in games and many other problems, and because I was also in intermittent pain over long periods, I was determined to try and find a solution. Initially, I thought it was to do with the way I was sleeping in bed, and indeed that is a major factor. I found that sleeping on my back was nearly always bad. It flattens the back out in a way, I think. So I developed a technique where I would twist my back so that my legs were to one side and my shoulders were to the other side. It took a little while to learn to sleep like that, but essentially if you twist your back, it will usually adopt a better natural curve than it will if you sleep more or less straight out. So try always to twist your back. But there were other problems which I wish to address. And I've been told I should not play rugby, which was a favourite sport of mine, and I was determined to get back and be fit again. So I developed the habit of setting an alarm clock to go off every 20 minutes or so, a bit longer perhaps, but I would then wake up, see how I felt, and if I felt better, I'd make a mental note, or if I felt worse, I'd make a mental note. I'd then go to sleep again in another position. I'd then be woken up by the alarm clock, work out again where I was and whether my back was better or worse. I did this for a period of 2 or 3 weeks, and I had to move out of my bedroom as my wife didn't like the phone keep going off. But eventually I developed a good list of the positions I needed to sleep in. And after a matter of 6 months, a year, it's quite a slow process, this. It got better and better. Now, I did this some 50 years ago, and basically I have not had problems with my back since. I was able, by that method, to work out the positions one should be. And this is when I realized that most of these problems are what they call L4-5 or lumbar problems, in the small of your back. And it's because the pelvis, the bone I talked about just now, is tilted like that. So I thought if only I could make a device that would push it forward, that might help it. Quite a few people before have made it a back support, but it's usually above the waist, and while it helps, I didn't find that very effective. But I eventually made this little gadget, which you put with the pelvis and pressing hard against here. It's made of 2 different materials, so this bit is quite soft, whereas this bit is stiffer. You can see this is well used. But the back is then pushing here, and you put it at the back of your chair so that when you sit down, this doesn't happen because this part here is being pushed on. And that enables you to sit. You then push back. So if anything, it supports the pelvic bone, which is much better than putting a curve into the spine itself. And I now wear one of these when I'm sitting at my computer and when I'm driving the car. And I know that if I sit there for an hour or two, I'll get up and my back will feel better afterwards. It is such a help for me. I've actually adapted a motor car seat so that I can sit in front of my computer with this in my back, my hands comfortably on the keyboard and looking slightly up at the screen, which I put on an extension so that I'm able to work most of the day on occasions without any long-term discomfort in my back, which has really been a huge benefit for me. I went back to playing rugby, and I didn't stop until I was 50. I'm now coming up for 90 and still living a very active and lively life, which I could have never done if I hadn't cured my back problems.